Good afternoon, everyone. You're all very welcome to our AWARE webinar today on grief, loss and depression. My name is Dr. Susan Brannick and I'm joined by David Shannon this afternoon. So I might just allow people to join. So as we're letting people kind of join in, maybe just taking a moment to settle in, getting yourself a drink, and we'll start shortly. So welcome again to those just joining. My name is Dr. Susan Brannick. I am clinical director here and a clinical psychologist, and I'll introduce my guest David Shannon more formally in just a moment. But just to say a little note on our webinars here at AWARE. So for those of you who might be new to joining us today, we run webinars on the second Wednesday of every month. They are on a range of topics around depression, anxiety, and related mood conditions. So in AWARE, we offer education, information, and support to people living with depression and anxiety, and you can find more information about all of our services on our website, aware.ie. So just to say a little note about the webinar this afternoon. So as I said, we're going to be talking about grief, loss, and depression. What we'll do is we'll be talking today till just before 1 o'clock. And I suppose maybe a note on the topic itself. So really kind of prioritizing self-care in our conversation today. I'm aware that many people might be joining at different stages of their grieving process. So I hope the information that we talk through today is helpful and of some comfort to you, whether that's for yourself or for someone else. We encourage all your comments, questions, reflections. So just to say, maybe we may not be able to answer individual queries, but we'll do our best maybe to take the kind of broader themes that might be coming through the chat. And I'll signpost to some bereavement resources at the end of our conversation today. And we'll also circulate them with the email that goes out after the topic today. And maybe just to say again, to kind of connecting in, if anything kind of arises for you in our conversation today, maybe connecting in with your own supports and kind of thinking about what might be helpful after we log off today, and even pausing the webinar if that's helpful. The recording will be on YouTube after 1 o'clock, so you can always pick it up at a later date if that's helpful. So just to introduce David now. So I'm delighted to be joined by David Shannon, who is a senior psychologist in St. Luke's Radiation-Oncology service in Dublin. Prior to this, David had worked in palliative care at Our Lady's Hospice, Harold's Cross, for 7 years. David has pursued an interest in the application of mindfulness in palliative care for over 20 years and completed a doctoral thesis on the role of mindfulness with patients receiving palliative care. As part of his work in oncology and palliative care, David also works regularly with patients and families exploring themes of grief and bereavement. David, you're very welcome this afternoon. Thanks for joining.
Thanks, Susan. Thanks for that intro.
So I don't know, David, if you wanted to say anything else about just kind of that note on self-care before we kind of get into thinking about some kind of definitions and just sort of defining what it is that we're talking about when we start to talk about grief, loss, and depression.
Yeah, thanks. I mean, I think you put it very well. That you know, even though I guess we've maybe begun speaking a bit more openly about death and dying in society, and we have things like grief cafes or death cafes now that are springing up. I think it's still for many of us a difficult topic to speak about, and obviously if people are joining, with a very live grief or a very live loss that they're experiencing, then yeah, I would absolutely encourage you to take good care. As you mentioned, Susan, this will be recorded, so people could come back to it, you know, take maybe bite-sized chunks, take a break, take a pause, and re-engage again. So just to really honor your own kind of experience of listening and hearing this session, and yeah, to take any pressure off oneself to you know, to feel any particular way, but just yeah, just to really mind ourselves as we go through this session.
It's a really nice description, David, and I guess maybe a bit of a theme of where this kind of talk might go. I suppose the importance of kind of honoring, allowing our own experience without that pressure to be a certain place or to get somewhere quickly, then some of those issues can come up. So that'll be kind of themes we kind of continue to talk about as we go on. So is it worth kind of just saying a bit about, when we say grief, what do we mean? Loss and depression, maybe we might have a bit more familiarity with as a concept, but do you want to start us off in that area?
Yeah, sure. Well, I mean, obviously in kind of everyday kind of conversation, we use these terms very interchangeably, and actually even in the literature itself, these terms are used interchangeably. Particularly grief and loss are used pretty much interchangeably. So I mean, depression obviously is a term to really capture the experience of intense low mood, persistent low mood, over a, you know, an extended time period, and that, even though often there may be losses associated with low mood, I guess when we're talking about grief and loss, we're very specifically talking about something quite identifiable. So something has happened, and particularly in the case of bereavement, the death of someone close, or something close has happened. So so yeah, I guess it's that kind of identifiable loss that we could associate more with the kind of grief that we associated with bereavement. But obviously we experience many losses in life, not just of those close to us, but you know, maybe a range of losses.
That's a helpful way to describe it, in a sense of that kind of the bereavement being kind of located specifically to the loss of a person, perhaps. As you say, we can have lots of losses, loss of role, maybe loss of identity, loss of kind of meaning at various points in our life. So that's a kind of a broader theme. And when we think about grief, how would you sort of, and I don't even put you on the spot for the dictionary definition, but I guess it's kind of, what do we mean when we say grief, or what do we mean kind of in everyday language, and is there a psychology language that we would kind of use? Or
well, I mean, I think the you know, in the literature, grief is really described as an appropriate natural response to loss. You know, so you know, the fact that it's universal, and it's you know, it's a natural experience. In a way, there's no way of avoiding grief, really. And you know, there are many theories, including, you know, attachment theory, which you know, really kind of suggests that because we're kind of hardwired to bond, to make strong connections with people, and even with places, when they get ruptured, and we find ourselves dislocated, or when our relationships end, either through natural causes or just very abruptly or suddenly, there's no way but to feel grief for the ending, for that ending. So so absolutely, you know, grief is a natural, predictable response to loss.
True. Yeah, and I guess, yeah, maybe some people might term it as an attachment injury. Maybe, yeah, it's kind of grief, as you say, kind of grief of relationships, or maybe grief of related to loss of role. Or I'm also thinking for people living with chronic illness and kind of around getting a diagnosis. There can be a grieving process for I guess the life that you might have expected or hoped for or thought. Not to say that this other life isn't going to have meaning and value, but I guess there's a process to go through, isn't there, to let go of kind of an attachment to something and moving on to a kind of how that landscape might look differently.
Yeah, exactly. So so when I guess often, even though we know intellectually, we know rationally at a certain level that nothing lasts really, but still, when life reminds us that nothing lasts, or that things can change, and sometimes can change, very suddenly or unpredictably, we feel the effects of that. So yeah, part of it is about really normalizing, the experience of grief and loss, and the wide range of feelings and emotions and thoughts and behaviors that go with that.
And I guess there's different kind of psychological kind of theories, isn't there, around that process of grief and loss, and kind of what might show up. If people have mixed feelings, don't they, on that Kubler-Ross? So everyone will know about it. So the kind of the sorry, words are losing me at the moment, but they going through different stages of grief. And yeah, I guess that idea, not to get into the history of that theory, but I guess that idea of kind of that you would move through sequentially through reject or denial, anger, and I guess grief maybe being a lot more complex than that, and multifaceted maybe for the individuals. So different kind of theories. What do you think is helpful, I guess, in thinking about all of that research and theory for someone who's maybe experiencing loss or in a grieving process, or concerned about someone who is?
Yeah, I mean, I think theory is helpful to a point, right? It gives us a certain way or lens maybe to understand certain types of experiences. But yeah, I think what happened with the Kubler-Ross model is that it was kind of maybe taken too literally. And I think even, in the early days, it was really a way to try to describe how dying people approach the end of their lives, and that these different stages or experiences of grief might be part of the natural dying process. But of course, it's not a rigid thing, and was never, I think, meant to be a kind of a linear kind of rigid model. But in terms of a kind of a first attempt to try and describe what people go through, and particularly maybe what dying people go through, I think it was quite a helpful model. I think, maybe one thing to say about grief, particularly, for people who may be dying, is that, or maybe supporting people who are dying, is that there's a lot of anticipatory grieving that happens before the person dies. And again, that's a very healthy, natural part of the grieving process. So that anticipatory work, that kind of preparatory work that we engage in is so helpful, because I guess when we go back to thinking about how we're hardwired for relationships, the relinquishing or the letting go of those relationships, or the changing of those relationships, is very hard work. It's so in that sense, it's a kind of inner work and outer work that we go through. I think, when we're dying ourselves, or when we're supporting somebody who may be dying.
What do you think that would look like? I guess, or if you think about some examples of what someone might be doing in that anticipatory or that kind of preparatory work.
Well, I guess the experience itself is very akin to, the grieving process, following the death of somebody. So, the whole mixture of feelings and emotions and thoughts, which often, I guess sometimes might be difficult to acknowledge, because there may be a sense of, and this would be correct, it hasn't happened yet. And yet there's a part of us, and maybe it's a certain protective part that is kind of preparing us for what will happen. And so, it's amazing how kind of trustworthy the grief process is, in that it is often preparatory, and it often it's also very trustworthy, I think, in terms of just how much grief at any one time, at any one moment in time, we have to experience, or that we do experience. So I think there's something very intelligent about the grief process, that gives us just enough, maybe, that we can tolerate without completely maybe overwhelming us. So maybe there's a certain kind of a kind of mercy or intelligence in how grief, in the grief process itself, that often it doesn't overwhelm us. Of course, at times we will feel very intensely, but in terms of giving us some respite, often I think the grief process is very kind of trustworthy in that way.
There's an inherent kind of moderation in it. So there's as much as can be kind of taken at various points, maybe. But yeah, it makes me think about people who, because grief is sort of universal, isn't it? And loss is universal. And we're all going to come to that with our different kind of, life experiences, ways of relating to ourselves, ways of relating to our feelings, and ways of relating to other people, and I guess I wonder, in terms of, and maybe this is kind of, as we'll think about it more broadly, how someone might distinguish between this kind of trustworthy kind of grief process and what might be a depression, or what might be actually a low mood, and how you might know the difference, maybe, or can you know the difference at various points?
Yeah, well, I guess often some of the kind of I guess what you might call the symptoms might look quite similar. So there may be loss of appetite, or persistent low mood, or difficulty with sleep, or with functioning in general. And I think, I guess in terms of, as we mentioned earlier, when grieving, there is often a very identifiable loss. But that's not to say that there aren't losses associated with this word, depression, because obviously, depression also doesn't just happen in a vacuum. Often it is a response to something that has happened either in the recent past or maybe in the distant past. And it might also have become kind of, so maybe some of the more identifiable reasons why somebody might have become depressed might in some ways have become lost over time. So maybe it's not so identifiable, but I think in grief and bereavement, obviously, and in whether, as you mentioned before, some of the losses of in relation to maybe a relationship or an imagined future, or it may be in relation to something work related, or you know, these kinds of losses are more identifiable, but the symptoms, how we experience the kind of grief associated with those losses may look very similar to a depression. So that's why it can be very helpful to speak to somebody who I guess can help you to as the title of this talk outlines, to kind of untangle maybe some of those knots, or some of the strands that might have led to the experiencing of low mood, particularly if it's very persistent or overwhelming, or just very difficult to move on from.
Yeah, because I guess and it can be complicated too by how someone might have passed away, and your relationship with them, and I guess guilt can play a role for people at times, and shame perhaps, and a whole range of different emotions that are all very normal to feel. And I guess there's something, as you say, then knots is maybe a nice word of maybe getting stuck sometimes in some of those pieces that can feel very challenging. And I guess that makes me think about kind of some of the myths maybe about what you should or shouldn't feel in a following a bereavement, or a kind of a loss, or the expectations that we put on ourselves around time. So, by this amount of time I should feel better, or be able to kind of put this in,
Absolutely. I mean, I think it's interesting that in our time and in our culture and in society, there are all of these kind of expectations around grief, and that it's interesting that our culture has these expectations, given that generally we probably don't do grief so well, or death and dying so well, because I guess it's become a very siloed kind of event now and experience, so much so that there's almost a sense associated with death and dying that it almost shouldn't be happening, or that something has gone wrong in the life process, that a death has occurred. But yet at another level, we all intellectually know that death is the natural ending of a life. It's just that somehow that kind of has gotten lost somewhere along the line, and so these cultural expectations around how long one should expect to grieve for aren't based often on anything very real, other than maybe a kind of a general sense of what's appropriate. And of course, each relationship is unique. Each bereaved person's experience is going to be unique, because their relationship was unique. So it might be helpful to see, in part of the preparation for this meeting, somebody who's quite an expert in this grief field is a guy called David Kessler. And he talks about the acute grief period really extending from anything up to 2 years. And I think that's quite a helpful maybe timeline, because I think often there might be a sense of, well, yes, there are certain kind of allowances for grief in the early part of grieving, in say the first 6 months or so. But often maybe we don't tend to think of that somebody might be, quite actively grieving for much longer than that. And so, when it comes to something like somebody getting stuck in their grief process, to a certain extent, that's often very difficult to determine until a decent period of time has actually elapsed, because the intensity of feeling, can just very appropriately, remain so for quite a period of time.
I think that's really important, and we're kind of holding on to that because we might come back to then, I guess, what might be helpful in those different phases for people. Obviously, not one thing is going to be helpful to everyone, but maybe some ideas of things that can be of use. But just to kind of come in on some of the questions and reflections there. Thank you all for sharing. And as I said, we may not be able to get to your specific query, but maybe we can bring some of the themes, because really moving and really kind of interesting kind of questions coming in too, and just kind of on what you were speaking there about that kind of decent amount of time. Someone has mentioned in there about a loss that they experienced, and I guess this idea of grief being a lifelong journey, you know, the long nature of grief, how, and if I might quote this person, how you can revisit it many times. It's almost like you lose the person many times, which I think is really true, isn't it? And certainly with new life events where they're not present for, as a kind of obvious example, but the kind of that, and there might be a different relationship to that grief, or that you have with that grief over time. I don't know if that will say a little on that.
Yeah, I think it is a very helpful orientation to you know, see grief as an evolving process, and you know, something obviously that never leaves us, but that kind of might ebb. There might be an ebb and flow to it, and I guess again, because we maybe get some ideas from culture or society or media, I'm not sure, but that there should be an identifiable endpoint, maybe, and you know, the you know, the sense that you know, yeah, that maybe enough time has elapsed, but actually, yeah, as that person has mentioned, you know, if the relationship was a relationship of real depth and meaning, how could we ever expect to you know, really fully you know, come to terms with or integrate the, you know, the experience. So it's an ongoing kind of dialogue, I guess, that we have with grief. And I think one of the things that I think might be most helpful to people in the grieving process is this sense of continuing bonds with the person, that you know, we can, the extent to which we have kind of internalized the person by virtue of our relationship with them, that person is always available to us, you know, internally as a resource. So just in the same way that somebody who's living on the other side of the world, you know, we could maybe call them to mind, even though they're not physically present. I think in the same way, you know, something that might be very helpful in the grief process is to give ourselves access to the person who has died, because we really don't need the person to be physically present to be able to you know, ask their advice, to know what they would say or advise in any given situation. And that's a real kind of internal resource that we have a lot of say over.
That's an it's an interesting idea, isn't it? That continuing bonds, and as you say, that kind of calling the person to mind, having a fair idea of what they might suggest or how they might make a joke about something that, you know, or that kind of knowledge of the attachment, isn't it? And
yeah,
that never goes, but that will be an internalized part of that relationship, won't it? And I guess there's some solace maybe in kind of thinking about that and how you might go about that.
Yeah, and I think maybe one of the places maybe where we might get ourselves stuck in the grieving process is for some reasons we may not feel like we should do that or can do that, or you know, that maybe there's a sense that that we cannot give ourselves access to the person who's died, but actually, you know, there, you know, we could see it as a way of continuing to honor our relationship and to keep that relationship alive within ourselves. The fact that we don't seek to kind of abandon that relationship.
Mm. And I guess maybe there's a question in here that kind of relates in a sense to kind of the broader idea, I think, that speaks to ritual around
Yeah.
death and I guess grief and loss and how you might go about kind of I guess negotiating that path of someone's possessions. You know, many people across the country will be in that situation of being faced with a house and kind of everything in it, and so that kind of being a task as well. And I guess it just makes me think about sort of objects, and as you say, that continuing bonds and internalizing something, and sometimes that can get a bit stuck too in terms of those bonds being located in a lot of objects, and maybe an inability to know where to start or to let go of certain things, and kind of how you manage that, really.
Yeah, and you know, it might be helpful to really seek support with that, to try and navigate that, because yeah, there might be a sense of honoring the person to an extent that you know, maybe creates some kinds of other you know, unanticipated difficulties, and that might prevent the grieving process from kind of evolving. So if the grief process is getting stuck for some reason, I guess really what we want is to be in a kind of an open and fluid kind of relationship to the person and to our grief, and so yes, the holding on to objects as a way to honor the person might be one way that a person or a family is sought to honor the person, and there might be other ways. I think, you know, it's interesting, the idea of external objects as a way to remember and honor the person. I think maybe that, you know, might belie a kind of a sense that maybe we can't trust our own knowing of the person, or maybe not trusting our own internalizing, or not trusting our own relationship with the person enough, that might be enough. That we might also need these external objects to almost validate our grief. And maybe there's no one size fits all there. You know, maybe for some people they really do need those external objects as a reminder. But I think there might be something very valid about trusting our relationship with the person and honoring that in a way, as that person mentioned, through different rituals, and we probably all have them, you know, in different ways, and in different places. You know, I think for all of us, there are probably locations where we might feel closer or further away from somebody who's died, and all of those can be really, really helpful in terms of our honoring and you know, continuing our relationship with the person who's died.
I guess there's a theme, isn't there, of kind of allowing the emotions that you're having, and kind of, as you were saying, kind of trusting in that process. Sometimes it will maybe feel very difficult, and other times maybe a bit more manageable. And I guess it makes me think about whether there's sometimes maybe a fear of forgetting someone as well as it being kind of nice to have tangible, concrete kind of things. Someone as a different way of remembering. I guess it's, as you said, there's no one size fits all. So it's about kind of navigating that. And I guess just kind of thinking about some of the questions that are coming in. Another one maybe, we'll kind of keep talking about that idea of sort of being able to untangle, maybe whether it's anxiety, whether it's, and we'll talk a little bit about kind of complicated grief, but standing back from that a little bit, if someone is in a grieving process or experiencing a loss, how might someone support them, do you think, or what can be helpful to think about there, someone that you care about?
Yeah, well, you know, I think first and foremost, you know, being able to talk to somebody at a level where, you know, your experience can really be unpacked, in a way that, and in a way that can be really heard, can be so valuable. So not having to, I mean, so often, you know, we hear people almost being praised for being kind of strong in inverted commas, or, you know, for, yeah, just kind of this sense of maybe almost kind of, you know, kind of getting back to normal. But I guess there is no normal, or at least there's a, life should, you know, very definitely be changed after the death of a significant person in our lives. So, so in a way, there's no going back, to how things were. And that also goes for, you know, working with somebody, with illness, which I do a lot in my day-to-day work in the hospital. So there's no going back to how things were, but that doesn't mean to say that, the future can't also, you know, be very nourishing and be, you know, have even greater meaning, as a result of what's happened. So I think unpacking the experience without it being closed down, I think often maybe very, very well-meaning people around us, might try to maybe, you know, contain our grief, but sometimes maybe grief needs a lot of space, and there are a lot of different threads, you know, based on our relationship, and our relationships are often complex and, not straightforward. So there may be, as that person mentioned, there may well be a mixture of feelings, tied up in, you know, in the experience of grief. So being able to untangle some of those threads, and really trying to, I guess, kind of relocate ourselves in it, as a result of what's happened, you know, it is just vital work that in a way we kind of have to do. There's really no way around it, except to allow ourselves to experience, as you said, the feelings and emotions, that are so much a part of grief.
It's really important, isn't it? I guess thinking about, as you say, supporting someone, and whether it's kind of in that process of a grieving process around a bereavement, or there's a lot of comments in, and again, thank you for all your comments, and yeah, really sorry to hear about the loss that people are experiencing, you know, and I guess being at different stages of that grieving process, people are going to have questions, I think, always about what's normal. What's normal for me is going to be one that maybe kind of comes up, and certainly is coming up through our comments there. But to say maybe something a little bit about supporting someone, whether it is anxiety or depression or grief, I guess maybe what we're saying is that allowing space for it, to kind of be able to I think what you mentioned there, this sort of idea that kind of it's great to be sort of getting on with things after a certain time, as opposed to allowing maybe a bit of space for how someone might feel where they're at. So kind of being able to kind of hear that. And I guess there's something of a personal responsibility in that as well. Because as I said, grief and loss is universal. So there may be things that kind of resonate with you that you may not be expecting. So it's kind of resourcing yourself as well, if you're going to be in a position to kind of speak with someone or explore how they're really doing, as opposed to grand getting on with it. You know, if you're kind of offering that space, kind of thinking about how that could work, would you say, do you think?
Yeah, absolutely. yeah, I think, it is very individual, the grief experience, and maybe sometimes when we step back and we think about the grieving person and we think about the relationship that they had with the person who's died, often it really makes sense, the intensity of the emotion or the duration of the grieving process, particularly if it's more extended. I mean, I'll never forget the first person I worked with who was bereaved. She was a lady in her mid-80s, and her husband had died. Her husband of like 60 years plus had died, and her family were very concerned with her, about her, that she was still very actively grieving 2 years later. But actually, it was, in some ways, it was the pressure to almost be, to feel better, that kind of was a trap in some ways, to her grief. I think as soon as she was allowed to really own the fact that, of course she was going to continue to grieve for the rest of her life, and given that she had lived many more years with her husband than without him, it just made complete sense. So I think it was maybe the expectations of those around, that lady, that were really unrealistic, maybe, and unhelpful. And I think when her grief could be validated and normalized on the basis of, the depth and duration of her relationship, then things really fell into place and made sense. So yeah, I think we do need to sometimes maybe check our expectations of the person who's grieving.
Sure.
And obviously, we can talk a bit about prolonged grief as well, but I guess, there's always good reason, also very good reasons why somebody in prolonged grief might be getting stuck.
And is it worth saying a bit about that now, maybe the differences between that kind of more complicated or prolonged grief?
Yeah, so I mean, just to say, first of all, that this is still quite a controversial kind of diagnosis in terms of the kind of medical model. And it's a relatively recent diagnosis, this diagnosis of prolonged grief disorder, or what used to be known as a complicated grief or complex grief. So the diagnostic criteria are, that really there's no let up in the intensity or yearning, or the thinking about the person who's died, after a year. So really no change in the intensity of the grieving process after, a minimum period of a year has already elapsed. But when you unpack that, then those who are maybe most at risk, for a complicated grief experience, it makes a lot of sense, because it might be through the suddenness of the death, or maybe through a traumatic death, or it may be something to do with the degree or extent of suffering associated with the illness or with the death itself. So, there's something in the grieving process that the griever, or the person who is bereaved, we get to replay the circumstances surrounding the death, in a way, of course, in which the person who's died, doesn't do. So I think, that's a key aspect of more prolonged grief. This kind of constant, maybe replaying or reworking through, what has happened, the circumstances surrounding the death, and often it's something, it's something very difficult, like something very sudden or traumatic. or where there was a high degree of suffering, or there was just something about the death itself that isn't allowing the person to move through and experience the ebb and flow of grief in a way in which might be expected after a decent period of time, like a year has elapsed.
It's interesting, isn't it? I guess as you were saying earlier, the David Kessler theory is maybe 2 years of acute grief.
Yeah.
But and as you say that, but maybe kind of no clear shift in many of those processes a year on, or as you say, there's a natural ebb and flow maybe. Yes, it strikes me that in depression, there's a very similar kind of mechanism, isn't there, in terms of rumination? So going over and over on a loop, maybe something from the past, and that can often be guilt or shame based.
Yes,
and
yeah.
that sort of thinking can, and I guess as we were kind of saying, kind of untangling that, and it's not for us to untangle here for people on the webinar, but I guess as a broader kind of as in not to entangle your own personal experience, but as a broader kind of theme, bereavement and loss and grief being related to maybe more specific kind of losses in a sense, but also depression, some, as you said, doesn't happen in a vacuum, and a lot of comments are coming in around maybe for someone with a chronic health condition, or maybe an imagined future, as you said, kind of whether that, what you might have, whether that's loss of relationship, and I guess getting outside of that ebb and flow, and being in a depression where that thinking is a bit relentless, actually. So that rumination may be fueling a low mood as well, and that kind of going into a longer time period. There's no ebb and flow in that. That's a fairly persistent rumination, maybe.
Yeah, absolutely. So again, the kind of healing aspect of grief is that it does give us opportunities to restore and replenish before maybe we're thrown back into more intense feeling once again, which, as you say, in depression, we're maybe not released from the grip of the rumination enough to experience enough of a sense of recovery of mood, or a sense of kind of refinding our balance once again. And the aspect of guilt that you mentioned, which can be similar in both the grief process, but also in depression. Guilt is interesting because often when guilt is part of the grieving process, it's often in relation to the extent to which somebody might feel that they could have or should have done more to support the person who is dying, or maybe being present at the death, or so the guilt might be very much associated with the dying process itself, whereas in depression, the kind of guilt that we would feel would be maybe more kind of diffuse and general and self-oriented. So that's probably a good distinction to be able to make between the kind of depression or low mood that we might feel in response to grief or bereavement versus in a depression, where often the kind of target of those feelings are very self-focused.
That's a helpful distinction. And I'm just reading through the comments here. Thank you all for sharing your experiences, and as I said, my apologies that we may not be able to get to your specific kind of experience, but I'm doing my best to read and hear them all as we go through, and I hope it's useful, kind of maybe what we're saying. They're sort of broader kind of concepts, aren't they? But I think maybe the word we haven't used, but I think what your approach is probably immersed in, is that sort of self-compassionate kind of approach, and a kind of allowing, isn't it? And just before we get onto that, I guess something else has come in that I think is probably quite common as well, in terms of that huge sense of fear And I think that
Yes.
fear can be around in depression, but also very much in grief and loss as well, about like, how do I keep going?
Yes.
What's life going to look like without this person? You know?
Yeah. 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 I mean, that might be the single most common, actually, thing that people say in response to the bereavement and grief following the death of somebody, you know, fearing the intensity of the emotions that might be released, and might they be completely overwhelmed by the intensity of the feeling. So maybe it's easier to just keep going, and to maybe not feel, or to use strategies as a coping mechanism so as not to feel. So maybe it's important to say that, again, that grief is a very kind of intelligent, trustworthy process, and that we can really take it step by step. Grief never really, even though I think this is what we imagine, and maybe where the fear comes in, we imagine we'll be overwhelmed ongoingly. But if we can kind of trust that the grief process will only probably ever give us as much as we can tolerate, and then, funnily enough, gives us periods to recover. And often people will sometimes feel guilty at actually not feeling the grief all the time, or not feeling in touch with their loss all of the time. And again, that's part of the natural grief cycle, that we get released to a certain extent to recover before, you know, experiencing more intense emotions again. So if we can trust this kind of oscillation, so there's a really helpful model which is called the dual process model of grief, which really speaks to this fact that often we're very much in connection to the feelings and thoughts and around our loss and the death of someone. And then there'll be other times in our day when we'll be very much just in the normal kind of day-to-day flow of things, where our energy will be directed towards things that are happening currently or future plans. And so that ebb and flow, that oscillation between you know, what's current or future, and also very much being in touch with our grief. That's again a very, I think, helpful way of seeing that that's normal. You know, so if we are tending to feel guilty for not being in touch with our grief all of the time, just to say that you know, that does seem to be part of the intelligence of how grief works, that it doesn't continually overwhelm us, but gives us these periods of recovery.
Well, I guess if someone's watching here and kind of unsure about, you know, kind of, maybe it's not so much in the immediate times following a loss, but maybe a significant amount of time has passed and they're still feeling this huge anxiety or fear or low mood. What would we think would be helpful in that instance, kind of more generally?
Yeah, well, I mean, I think if, as you say, the intensity is really persisting, then it probably is time to go and speak to somebody if they feel that that's something that they can do. And it probably person would probably benefit from somebody listening to them who can really hear them out, and really allow them to talk without you know, needing for them to be any particular way or feel any better. You know, that might need to be a professional person in the first instance.
And I guess maybe, as I was saying at the beginning, we'll kind of link to the Irish Hospice Foundation have a support line, and you you can find their details on their website, and we'll send those details with the email that goes along after this webinar. So I suppose it's just thinking about kind of reaching out for support if you kind of that isn't kind of diminishing in a sense of that strong intensity, or maybe an inability or difficulty kind of getting back into some kind of a routine of life, you know, that as you say, maybe there's no going back, but there is a going forward if that feels very stuck. So it's maybe kind of thinking around that. And thank you for one of the questions that came in, which I wonder, David, if maybe you could signpost, because I think it's probably a really big one in terms of how you might talk to children about grief and loss, whether there's any, and maybe that we kind of think about that and what might go out with the email, but any of that you would know of that would support an adult kind of having those conversations?
Well, again, I think the Irish Hospice Foundation might be a good port of call, but I think, you know, in relation to children, I think children often take their lead from us. So depending on our, you know, our willingness and openness to talk about grief and loss and death, you know, we can, I guess, first and foremost, resource ourselves, but you know, if grief and death and loss is something that's spoken only kind of in hushed terms or not openly, then children will often take their lead from that there's something unnatural here or something very dangerous or something about this. Whereas I guess the more open we can be and the more age appropriate we can be. So, you know, knowing the child and knowing how much information might be enough, and the fact that it's clear and accurate, but also age appropriate, without needing to shield or overly protect. I think that's important.
I guess, as you say, maybe there's sort of supporting the child to make their own continuing bonds in a way that's going to be age appropriate, isn't there? And David, maybe I might just ask you to, as I kind of come to the end of our comments, and we're coming to the end of the time for today, maybe just for you, maybe taking a minute even to think about what's the most important thing that you'd like people to take away with them from the webinar. And to say maybe thank you for everyone who's joined us, and thank you so much for sharing your experiences. As I said, maybe I've certainly read all of them, but maybe can't speak to individual experience, but really encouraging you to, I guess, take a pause perhaps if anything has resonated or come up in this session today, maybe that pause before kind of getting on with the next part of the day's routine. And the Irish Hospice Foundation as well, if kind of seeking support, and I guess and aware as well, we'd always kind of encourage people to contact in with their GP as well, if that's a helpful relationship, if they're struggling, I suppose, if kind of mood or anxiety is kind of really stopping you living the life that you want to be living. So it's, I guess it's sort of, maybe as we're saying, resourcing yourself in the immediate, kind of that self-care piece, and then kind of in the kind of more medium to longer term, what's going to be helpful. And sometimes it is helpful to have that space, isn't it, as you say, David, to kind of talk through an expansive space where you can be however you want to be. So it's maybe not an absolute, there's no one size fits all here, but
yeah, I think, just to reiterate, just to thank everyone for joining and for their questions and contributions, and I guess to say that you know, when it comes to grief and loss, you know, there's something about really honoring our experience and honoring the feelings, and to a certain extent, you know, maybe touching back on the fear question, maybe trusting that you know, we can feel our feelings and come out the other side, you know, so that you know, this idea that no feeling is final, and that, you know, our feelings ebb and flow, and if we can if we can learn to kind of go with our feelings rather than trying to control them, we'll probably find ourselves in a much kind of easier place in relation to this ebb and flow that we all experience.
I guess as we said in the beginning, it kind of the impermanence of everything, including emotions, and kind of letting go of that struggle where possible. It's not an easy task, but it kind of, as you said, no feeling is final, and kind of trusting in our ability to come through the other side of that. Yeah. David, thank you so much for joining today. Really interesting and informative webinar. So thank you for your time and your compassion and expertise. Really, it's been really helpful conversation. So thank you so much, and thank you to all for joining. I know we're just on the hour, so I might just move to the webinar for next month. So next month we are going to be talking about depression. So why do we get depressed? Large question there. So I'll be joined by a expert panelist. Hopefully many of you will be able to join then where possible. So that's the 14th of May. So thank you all again. Thanks, David, and I'll see you next month, hopefully.
Thank you. Thanks, Susan.